Vaping is generally considered less harmful than smoking traditional cigarettes, but it is not risk-free. The primary dangers involve highly addictive nicotine, toxic aerosols, and unknown long-term health effects. Health experts emphasize that non-smokers, especially youths and pregnant individuals, should never vape. Brain and addiction. Nicotine dependence. Most vapes contain nicotine, a highly addictive substance. It can alter adolescent brain development, leading to lifelong issues with concentration, learning, memory, and mood. Gateway effect. Studies show that youths who vape are significantly more likely to eventually transition to smoking traditional combustible cigarettes. Heart and lungs. Respiratory damage. Inhaling vapor exposes the lungs to tiny particles, volatile organic compounds, and heavy metals. Chronic use is associated with an increased risk of asthma, chronic bronchitis, and even sudden lung collapse, pneumothorax, in vulnerable individuals. Cardiovascular strain. Nicotine spikes adrenaline, raising your heart rate and blood pressure. Regular vaping can stiffen blood vessels and impair blood flow, increasing your risk of heart attacks and other cardiovascular issues. General side effects and unknown immediate irritation. Common short-term side effects include coughing, dry mouth and throat, headaches, shortness of breath, and dizziness. Unregulated additives. The aerosol is not harmless water vapor because many e-liquids are not strictly regulated. Users can inadvertently inhale toxic, cancer-causing chemicals, contraband products, black market, or unregulated devices, especially those containing THC, often contain illicit and highly dangerous chemical fillers. For authoritative guidance on the use of vaping as a cessation tool, refer to the NHS Vaping Myths page to read a comprehensive breakdown of the long-term scientific and medical concerns. Check out the CDC Health Effects of Vaping resource. Vaping is highly dangerous for teens because e-cigarettes typically contain highly concentrated nicotine, which alters developing adolescent brains. It severely harms attention, learning, and mood control, rapidly triggers addiction, and exposes young lungs to toxic chemicals linked to respiratory damage and chronic bronchitis. Key health risks. Brain development. The human brain continues to develop until around age 25. Nicotine exposure during this period can rewire the brain, causing lasting impacts on attention span, learning, impulse control, and mood. Rapid addiction. Nicotine is incredibly addictive. Many teens become dependent after only a few weeks, leading to intense cravings, anxiety, and irritability when they try to stop. Toxins and lung damage. Vaping isn't harmless water vapor. Aerosols often contain toxic, volatile organic compounds, heavy metals such as lead and nickel, and chemical flavorings that can cause coughing, shortness of breath, and irreversible lung damage.